So I don't know who needs to hear this, but substances are never going to go anywhere as long as there's a demand for them. Do you like science? Because I like science, and it's okay if you don't believe in science. So every time we try to end a substance, the substance becomes more dangerous. And studies show that our laws are a huge reason why so many people are dying. But you might not like science, so let's go over a history lesson. On January 17th, 1920, they outlawed alcohol, what we know as today as Prohibition. That's when people who were involved in organized crime, such as Al Capone, had the opportunity to make millions of dollars when they opened a black market for alcohol. But because the alcohol wasn't regulated, it wasn't always made properly. So unfortunately, people started going blind, they started going into psychoses, and some people even died. All while Al Capone sat there and made bank. In 1933, our government realized that they needed to end prohibition and opened safe consumption sites so people would stop dying. Those safe consumption sites today are known as bars, and the government was able to tax alcohol. Fast forward to 1995, the FDA approved Purdue Pharma's new drug, OxyContin. By 1996, Purdue Pharma launched OxyContin. Purdue Pharma used deceptive marketing practices saying that only 1% of people would actually get addicted to the substance. And that's when Purdue Pharma did a mass marketing campaign. Doctors were getting paid kickbacks to prescribe it. Sale reps received huge bonuses based on prescription volume. Greed is what started the opioid epidemic. Lies is what started the opioid epidemic. Billionaires is what started the opioid epidemic. Now, Purdue Pharma isn't the only one to blame. In the early 2000s, after facing growing outrage towards the opioid epidemic, the DEA cracked down on opioid prescriptions. They shut down pill mills and started revoking doctors' licenses. They imposed stricter limitations on what doctors could prescribe their patients, their chronic pain patients. About 18 million people who were dependent on OxyContin got cut off of their medication overnight. Patients were left in severe withdrawal with no help or support. They were cut off of their regulated medication without warning. And many turned to the street supply to not experience excruciating withdrawal. With the cracking down of the prescription opioids, the price of street pills went up. And heroin was cheaper, so a lot of people turned to heroin. As the demand for heroin went up, the DEA's job to end heroin stepped up a notch, leading to people trafficking fentanyl instead of heroin, because fentanyl is stronger, cheaper, easier to traffic, and you don't need such a large quantity. Organized crime realized, people wanted the OxyContin, so they started pressing down fentanyl into pills to make them look like OxyContin, and then they sold them as OxyContin. And then the DEA, 4 years after the fentanyl was already in the supply and they didn't say anything or even warn anybody, they decided to crack down on the fentanyl. And organized crime is always one step ahead of them. So by the time the DEA is cracking down on fentanyl, we already have xylazine in the supply. Xylazine is an animal tranquilizer used to put horses and cattle to sleep for surgeries. The supply changes drastically every couple years. Right now, we don't even have updated withdrawal protocols for xylazine. Not to mention the new supply, overdose reversal protocols are changing. We ended marijuana prohibition in Michigan in 2018. And I want to talk about the tax revenue. In 2020, the government brought $45.7 million in tax revenue for marijuana. In 2021, $172 million. In 2022, $198.4 million. In 2023, $290.3 million in tax revenue for recreational marijuana. So if Trump is such a smart man, he would copy what Vancouver is currently doing and open a safe consumption site. Over 11,000 overdose reversal interventions, and not one death. Nearly 48,000 medical visits. We're talking wound care, STI testing, HIV testing, harm reduction services, rehab services. Clients are 35% more likely to go into detox or treatment. On-site counselors help transition to treatment. Public injecting has dropped by 44%. Discarded needles dropped by 54%. And car thefts have dropped by 25%. The police often refer people to the on-site safe consumption site instead of arresting them for using publicly or loitering. Emergency room visits and EMS runs have been down. Reduces the burden on police with overdose calls. Fewer 911 calls about loitering. Those approaches have built trust between the cops and the person who uses substances. Studies also show that the site did not increase crime. That sounds like an amazing place to be. Unfortunately, America consists of mass incarceration, black markets, and organized crime, increased drug-related violence, public health crisis, racial and social injustice, barriers to harm reduction, unneeded economic costs, and stigma towards people who use substances. Trying to get substances out of a country that can't keep substances out of their own prison is unrealistic. The war on drugs is over and drugs won. They're here for the stay, so we can either get with it or keep letting our friends and family die. The choice is yours, so have the day you deserve.